Lance Medical Consultants, if you run into the issue of your finger socks being too long on the patient's digits, one thing you can do is separate the finger sock and bring it down or more proximal. The secondary issue that you may encounter is upon bringing that finger sock down, you may have the finger sock itself being too long on the specific digit. If that's the case, you can trim out the finger sock at the base in a U-type shape, and that will allow the digit to fit deeper inside that finger sock. This will help with migration problems and eliminate that issue. This can be done specifically on each digit. Lance Medical Consultants, if you have an issue with your glove being too short on a Vector 1 or a Statodyne wrist-hand finger orthosis, you can window the glove. And what this will allow is it will allow the Valera on the wrist-hand finger orthosis to actually anchor itself on your arm better, as well as the blue T-foam on the Vector 1 hand CPM. The other nice thing about this modification is that pushing the patient's hand deep into the device so you can line up the MP axis of motion is much easier than when the glove is one solid piece. Lance Medical Consultants, another recommendation on the glove should be trimmed down on the side, as the glove will hang over on the ulnar and the radial side of the hand, and you will not be able to visualize the digit well, especially at the MP. So the recommendation would be to hourglass the glove with scissors. What this will allow is when the glove gets back in the Vector 1 hand machine and the patient's small finger and index finger are going into flexion, you'll be able to visualize where that joint is in relationship to the axis of motion on the machine. Lance Medical Consultants, this is a finger trapper, and this will help resolve issues with length as well as circumference fittings when the hand is very petite in nature. First thing we're going to do is trim the finger trapper in this fashion. And that can be applied to the device like so. Finger trapper can then be placed around the digit circumferentially. It will hold the plate on very well, and that will allow the machine to do flexion and extension without the digit coming out of the finger trapper. When the patient needs to come out of the finger trapper, they simply loosen the Velcro tabs. The patient slides their digit out, and if they need to re-don the device, they simply bring it into position and retighten their finger trapper sock.